I've just never met this person who says, I'm sleeping 8 to 10 hours a night and it's great sleep. I wake up feeling refreshed every day. I have no stress, no anxiety, no seasonal depression. I'm eating a well-balanced diet and I'm weight stable and I'm loving it. I've been working on this for years. I'm taking a ton of steps every day. My body feels great. I'm getting all the resistance training in. I do my aerobic activity. Everything is good. I'm just curious about blood work. I've just never met that person.
Welcome to Build Beyond, a podcast designed to challenge and guide you on your health journey so that you can meet your full potential.
During this episode, I want to talk about ordering your own blood work. It's very common now. I think it maybe is more common for people to be curious about blood work and to want to make decisions based on that blood work. Let me tell you a story. So my dad, who has since passed away, he got into a routine of ordering his own blood work maybe as much as 2 to 3 times per year. And he did this for quite a long time. And he would essentially interpret his own results and then buy supplements based on the results that he got. There are a lot of companies out there, and I'm not going to name any specific companies because I'm not here to throw anyone under a bus. However, these companies are, for all intents and purposes, they're supplement companies. And they're supplement companies that will also sell blood work. So you can go on their website, buy through them a blood panel, and then they would send you a form, and you could take that to like a Quest lab or any kind of lab, hand that order form to them. You'll get your blood drawn. There won't be any additional charge. That blood work will then be sent to the company, and then they will mail you a report. This particular company that my dad would use, he would get the report, and then he would have the opportunity to call in and talk to a physician who was employed by the company, who also had access to his results. And then they would make recommendations for a supplement plan based on the results. This seems like a good idea, and it can be. I'm not necessarily here to say it's a bad idea, but I'm here to maybe point out where this can go wrong. So supplement companies make money off of selling supplements, not off of blood work. And inevitably, if you do enough blood work, you will find things that could be corrected. And a lot of times, you may not have a lab high or a lab low, but you could be in that area. And then it's reasonable to make a recommendation as a preventative measure. And what ends up happening, at least what ended up happening with my dad, and what happened with me for quite some time, is you have a cabinet full of supplements that you take, and you don't really know if it's making you healthier or not. It could be affecting your lab levels a little bit here and there, but arguably it doesn't necessarily make you objectively healthier. So you maybe don't get sick less or have less pain or anything like that. So if someone is curious and they want to take their healthcare into their own hands, I totally support that. I am not against people getting on Google and searching things. I'm not against people providing their own healthcare to a certain extent. But if someone comes to me and asks if I think that they should go do this or something like this, it's not a no, but I want them to think about other things first. I want them to think about some low-hanging fruit. So are they meeting physical activity guidelines? And we can look at that a lot of different ways. How many steps per day are you taking? 4,000 or less, considered low. We want someone up in that 8 to 12,000 step range. Are we there? Are you resistance training 2 to 3 times per week? Are you meeting the recommended aerobic guidelines? Now, you don't have to meet all of these independently. For example, avid CrossFitters are probably meeting or exceeding the guidelines just from going to CrossFit regularly. So there are a lot of different ways that you can meet these guidelines. Someone may be getting their aerobic and their resistance training because they chop wood a lot, or they do different activities around the house that put their muscles under resistance. So I don't want to make it sound like someone has to go to the gym and train, but I would want to know, are you even close to meeting or exceeding the physical activity guidelines? I would ask them questions about nutrition. Nutrition can be a tricky topic because it can be misconstrued as me being judgmental, but I'm curious about protein intake and fiber intake primarily, because if you select foods that are higher in protein and higher in fiber, you tend to have a lower calorie diet, and you tend to feel more full, and you tend to choose foods that have higher nutrient contents. And for those who are overeating, they tend, and this is just a generalization, to eat foods that are lower in protein and lower in fiber and have less nutritional content. So potentially a more processed diet, which tends to be higher in sugar, higher in salt. And you can see we're trending in that direction. So I'd want to address that. I would want to ask them about sleep. Sleep deprivation is not good. So if you're not getting enough sleep, and if you feel like you're getting enough sleep, but it's not high enough quality sleep, sleep apnea is a problem. I think a lot of people have it and don't know it. And even for those who don't have sleep apnea, there are a lot of different things that we can do, or that you can do, to improve your sleep quality. I would want to have a real conversation about stress levels and anxiety and depression. These are not things that I treat, but I definitely need to screen for them. And something you can screen for. Anxiety is becoming a real problem. Maybe it's always been a problem. I just haven't been aware of it. But with social media and our phones always attached to us, and the polarizing political climate, I think it's becoming, in my observation, it's becoming more and more of an issue, especially with younger people. I just remember when I was younger, I didn't have a lot of these thoughts. I wasn't really concerned about politics. I was aware of what was going on. I wasn't stressing out about the environment. I didn't have social media. I didn't grow up with it. So I just didn't have a lot of that stress. I could be anonymous and I could go off and no one would know where I was, because, I didn't have a cell phone until I was maybe 21, somewhere around there. I didn't have a smartphone until I was in my early 30s. So a lot of this stuff just wasn't a problem for me growing up, and now it is a problem. And even for those of us who are older, who are adapting to the new technology and the way things are, we still experience these things. So anxiety can be a problem. Stress is a real problem. And depression, even if you don't have a diagnosable disorder. I live in the Midwest, so seasonal depression is a thing. So we have to consider mental health, at least consider it. We would need to think about, are there any other healthcare problems that you have, or that you think you might have, that haven't been addressed, or that you have questions about, because that can add to all of these issues. So to summarize, I would want to know about physical activity, general physical activity, resistance training, aerobic activity, sleep, nutrition, and mental health, and fears and concerns, and other healthcare issues. If all of those are in line, and someone says, "Oh, I want to go, and now I want to go do this blood work and potentially get some supplements and do these and make some decisions based off that," I'm all for it. The interesting thing is, I've never met that person. And maybe it's a selection bias because I'm a healthcare provider. So people who are feeling great usually don't come see me or come talk to me. But I talk to people outside of the healthcare environment. And I've never met a person, and they may exist, I've just never met this person who says, "I'm sleeping 8 to 10 hours a night, and it's great sleep. I wake up feeling refreshed every day. I have no stress, no anxiety, no seasonal depression. I'm eating a well-balanced diet, and I'm weight stable, and I'm loving it. I've been working on this for years. I'm taking a ton of steps every day. My body feels great. I'm getting all the resistance training in. I do my aerobic activity. Everything is good. I'm just curious about blood work." I've just never met that person. So if you are that person, yeah, probably go for it. I'd actually, if you are that person and you're going to do it, I'd be curious to see what happens. I I doubt that anything's going to change, better or worse, but I'd be open to that possibility. So when you're thinking about this, I'm going to use an analogy that I'm stealing from somebody, and I'll try to link this in the description. Now, if you're not watching, I'm holding up some big Lego Duplo blocks. So you've got something you want to work on, and you're thinking about going to get some blood work done and maybe buying some supplements or making some decisions based off the blood work. This big block, let's say this represents general physical activity. And this next big block I'm stacking on top is strength training. And this next big block is aerobic training. And this next big block I'm stacking on top is nutrition and everything that could go along with nutrition. And I'm stacking another block on top of that, and this is sleep. And I'm stacking another block on top of that. And maybe we've got stress, anxiety, depression, mental health. And then I'm stacking something else on top of that. This is your concerns about other healthcare problems that may be an issue, questions that you have. If you can incrementally go over all of this, and then you want to add in some blood work, and now I'm holding up some little tiny standard Legos and comparing the size, I think this is a good representation of the importance. So what ends up happening for a lot of people is they may have all of this stuff going on with these Lego Duplos. They're not meeting physical activity guidelines. They're not happy with their diet. They're not weight stable. They're not sleeping well. They have some anxiety. They have other healthcare issues. They have fears and concerns. They have all this stuff. And this seems like an insurmountable amount of things to deal with. So then this solution over here, just get a simple blood test, take a couple of supplements. What if it's that simple, and then these couple of little supplements based on your blood work fixes all this other stuff? And I'm not saying that's never happened or it couldn't happen, but it's pretty rare. And I think maybe there are plenty of anecdotal cases out there where that has happened. And if you have some kind of severe nutritional deficiency, or some kind of deficiency that would potentially be, you would see on blood work, maybe. But usually when you have those problems, you have other signs and symptoms. So for example, if someone has a severe vitamin deficiency, there's probably weird things going on where if we were looking at these big Lego Duplos, we would probably figure that out without blood work. We may add in some blood work, but now it's different. So I'm not trying to be anti-blood work. I'm just, for people who are going out and they're not under any supervision and they're just self-screening, I don't know that it's worth your time necessarily. And I can't be absolute with this because I'm sure there are plenty of people out there who said, I didn't have any signs and symptoms, but there was something going on. It was insidious. It hadn't hit me yet. And I went out and I did some blood work and I figured it out and we got it taken care of. And had I not just done this random blood work, I would have never known. I'm sure that happens. It's rare. And I've never actually met anyone where that's happened personally. I've heard stories, but I've never met anyone. So if you're one of those people who's thinking that, I've got some issues, I wonder if I do some blood work, if it's going to have an effect, what I would say to you is, let's consider all of these and let's not tackle these Lego Duplos all at one time. Let's acknowledge that you have all of these things that you need to work on. And then out of everything, let's just pick the one that you want to start with first. What motivates you the most? It might be walking. It's fine. It might be nutrition. It doesn't really matter. And then you work on one, and once you get that one under control, or you're feeling good with that and you feel like you can add something else, then we stack something else. And this might take a long time to address every issue and stack up these Legos to build what you want to build. But I've never seen it happen where someone takes the shortcut, goes and just randomly screens themselves for blood work, gets recommended supplements based on that blood work, and then all of this other stuff just magically clears up. It's just very rare, and rare to the point where, again, I've never met anyone where that's happened. So what I would say, if you're looking for my advice, if you're still listening to this, I think you would be better off trying to address some of these big ticket things. And the cool thing about these is that they don't really cost any money for the most part. Push-ups are free, for example. Walking is free. So if someone says to me, and I'm not trying to put anyone down, and make you feel like you're dumb if you're considering this, I am speaking from someone who's been sold on all of this stuff multiple times. I can't even tell you the thousands of dollars I've spent on some of these gimmicky things that I've been sold. And I just haven't gotten any benefit from it. And I feel like it's a common experience that people have. So if you're someone out there and you're seriously considering that, going and paying for your own blood work and doing these different things, and you have some issues, I am truly empathetic because I've been through it. And I feel like I can at least attempt to see it from your perspective. And what I would say to you is, first, I would applaud you, because if you're considering this, what you're saying is, my health matters and I'm willing to do something about it. I'm willing to expend energy, time, and resources, because it's more than money. If you're going to go get blood work, usually there's fasting. You've got to take time off work. You've got to drive somewhere. And then you are already kind of committed to at least the possibility of making changes after the blood work. So there is a motivation there. So what I would say is that, let's take that motivation and those resources, and instead of looking at the blood work first, let's look at all of this other stuff. Let's look at general physical activity. How many steps are you taking per day? Let's look at resistance training, aerobic activity. Let's think about things like fiber and protein and sleep and stress management and whatever other questions that you may have about other healthcare issues or medications you're taking or things like that. Let's look at all the low-hanging fruit and let's take care of this stuff first. And then it's not that we have to have all of this in order to make it okay for you to get blood work. I don't know if I'm expressing that right. We don't have to have all of our ducks in a row to request blood work. But I think it's worth at least acknowledging and addressing all of these things. And I feel like a lot of people don't, because it just seems faster. Oh, I can just go get a blood test. They'll tell me what's wrong. I can pop some supplements, which are relatively cheap, and then everything's going to be good and it's going to fix everything. And it's just not the case. And when you look at websites, for example, or social media for a lot of these companies, they, depending on how long they've been around and how big they are, they've serviced tens of thousands, millions of people. And they will have success stories that they'll promote. But those success stories probably only represent a tiny fraction of the total people who have tried this process. And most of those people probably aren't getting the results that they thought they would get. You're only seeing what the companies want you to see, because you have to understand that these services in this industry is unregulated, or not unregulated, it's poorly regulated, because there's some regulation, but it's very loosely regulated. I'm not talking about the blood work industry. I'm not saying when you go to Quest Labs that it's unregulated or poorly regulated. I'm talking about the supplement companies, because as I mentioned, I don't think there's big money to be made in drawing blood. There's big money to be made in what happens after you draw blood. And that doesn't have anything to do with the labs. So I don't want you to think that I'm putting down places like Quest Labs or any labs. It's the people on the back end who are potentially going to make money, a lot of money, off of the supplements that you buy. Because let's be real, it's a 50% markup on supplements, at least. And I know, because I have contracts with supplement companies. And There's no, physician, if a physician prescribes you medication, they can't make money off of that medication. They can bill the code for the service and whatever they're allowed to do legally, uh, but they're not making, that drug company isn't providing them a kickback for every pill that they push. And that drug company can't provide them incentives. And I think if they do, it has to be registered in a certain way. So that has all been removed for the most part. But that is not the case with supplement companies. Every pill that someone sells, they make 50% off of that. And they can make incentives. There's not a lot of oversight, if there is any oversight. And there's not testing on these things. So it takes, I don't know, 10, 12, 15 years to get a pharmaceutical drug to market. And you may have opinions about that process and you think it's not well done. I get it. But at least there's a process. You and I can start a supplement company today and put something out there. If we have the money. I mean, there's no one that's going to stop us. And we don't have to have our stuff tested. And just don't have to. We could just have really good marketing and good packaging and a good plan. So that's what I would say. If you're going to go that route, be cautious, because you may end up just spending a bunch of money on supplements that you're just going to excrete, and they're not going to have any real benefit on your health. So that's my 2 cents on going out and getting your own blood work. Again, if you want to do it, go do it. I'm not trying to put you down, but I think there's bigger bang for your buck. So you could spend less money and get more effect if you look at other things first. All right. I hope this helps.